Health economics is a specialized branch of economics that focuses on the efficient allocation of healthcare resources in order to improve health outcomes. It examines how healthcare services are produced, financed, and consumed. So, why do we need health economics? Healthcare is not like other sectors. Unlike buying groceries or clothing, the demand for healthcare is often urgent and driven by need rather than price or preference. The market doesn't always behave in predictable economic ways. That's why understanding the economics of healthcare is crucial for effective planning and management. Health economics addresses important questions like: how should scarce health resources be distributed? What is the most cost-effective treatment for a disease? Should government provide universal healthcare, or should it be left to private providers? These are not just theoretical questions, they have real-world consequences. Key characteristics of healthcare. Uncertainty: people don't know when they'll get sick or how serious it will be. Asymmetric information: doctors know more than patients, creating a knowledge gap. Externalities: an individual's health can affect the community, e.g., vaccines. Government involvement: most countries regulate or fund healthcare. Third-party payers: insurers often pay for services, not the patient directly. Headphone 2. Demand and supply of healthcare. In traditional economics, price is the main determinant of demand. However, in healthcare, the demand is driven more by need, availability, and perceived benefit than by cost alone. Demand side. Healthcare demand refers to the desire and willingness of individuals to seek medical care when needed. Several factors influence this demand. Income: higher income typically leads to greater healthcare utilization. Education: more educated individuals tend to seek healthcare earlier. Health status: chronic or severe conditions increase demand. Price of services: co-payments, insurance premiums, and out-of-pocket costs all affect demand. Supply side. Healthcare supply involves hospitals, clinics, doctors, nurses, drugs, and other resources required to deliver services. Supply depends on the number of trained professionals, availability of infrastructure and technology, cost of producing healthcare services, government policies and licensing. A unique feature in healthcare is that supply can also create its own demand. For example, the availability of new diagnostic tools or specialists may lead to increased usage, even if medical necessity is debatable. This is called supplier-induced demand. Headphone 3. Market failures in health. In an ideal market, supply and demand determine prices, and resources are allocated efficiently. However, the healthcare market often fails to operate efficiently due to several market failures. 1. Information asymmetry. Patients rely on healthcare providers to make decisions for them. This knowledge imbalance can lead to overuse or misuse of services. For instance, a doctor may recommend unnecessary tests or expensive treatments. 2. Externalities. Health behaviors have effect on others. For example, positive externality: vaccination helps reduce disease in the whole population. Negative externality: smoking causes second-hand smoke exposure. Without government intervention, people may not take this effect into account, leading to under- or overconsumption. 3. Public goods. Some health services, such as disease surveillance or clean air, are public goods. These are non-rivalrous and non-excludable, meaning no one can be denied access, and one person's use doesn't reduce availability to others. Public goods are typically underprovided by private markets. 4. Moral hazard. When individuals are protected by insurance, they may consume more healthcare than necessary. For example, someone with full coverage might choose an expensive procedure over a simpler, cost-effective one. 5. Adverse selection. This occurs in insurance markets. People who are already ill or at high risk are more likely to buy insurance, while healthy people might opt out. This can lead to imbalanced risk pools and higher premiums. Government's role. To address market failures, governments step in through regulation, e.g., licensing, quality control, subsidies and taxes, e.g., taxing tobacco, direct provision of services, health insurance schemes. Headphone 4. Costing and resource allocation. Let's now discuss how health systems determine the cost of services and how resources are allocated. Costing. Healthcare services involve several types of costs. Direct cost, cost directly tied to treatment, like medicine, lab tests, and surgery. Indirect cost, cost resulting from productivity loss due to illness or disability. Intangible cost, harder to quantify, such as pain, suffering, and loss of quality of life. Understanding cost helps policymakers and managers make better decisions about budgeting, pricing, and investing in health programs. Resource allocation. Resources in healthcare are always limited: doctors, beds, money, and medicines. Deciding how to distribute these resources is a central concern in health economics. There are two types of allocation. Technical efficiency, getting the most output, health benefits, from a given input. Allocative efficiency, allocating resources in a way that maximizes overall societal welfare. For example, should a country invest more in cancer treatment or maternal care? Health economists use various models and tools to evaluate these trade-offs. Priority setting is a controversial but necessary part of healthcare planning. It involves balancing cost, effectiveness, equity, and population needs. Headphone 5. Economic evaluation methods. To decide which interventions are worth funding, we use economic evaluation methods. These help compare the cost and outcomes of different healthcare programs or treatments. Let's look at the four main types. 1. Cost minimization analysis, CMA. This compares two or more interventions that are assumed to have equal outcomes. The one with the lowest cost is chosen. Example, comparing two brands of the same generic drug. 2. Cost effectiveness analysis, CA. CA compares the cost per unit of health outcome. It helps identify which intervention gives the best value for money. Example, comparing the cost per life year saved for two cancer treatments. 3. Cost utility analysis, CUA. CUA takes into account both quantity and quality of life. It uses a measure called QALY, quality adjusted life year. Example, comparing hip replacement surgery versus physical therapy in terms of QALYs gained. 4. Cost-benefit analysis, CBA. In CBA, both cost and benefit are expressed in monetary terms. This allows comparison across sectors, e.g., health versus education. However, assigning monetary values to health outcomes is controversial. Economic evaluation is essential for decision-makers to choose wisely when allocating limited resources. These evaluations should also consider equity, affordability, and population impact. Headphone conclusion of Module 1. Let's recap what we've covered in Module 1. Health economics applies economic principles to improve the efficiency, equity, and effectiveness of healthcare delivery. Healthcare demand and supply are influenced by unique factors like need, information gaps, and third-party payers. Market failures are common in healthcare, necessitating government regulation and policy interventions. Costing and resource allocation are at the heart of strategic planning and budgeting in health systems. Economic evaluation methods help determine which interventions provide the most value for money. In Module 2, we'll transition into the policy side of health systems, how decisions are made, how reforms are implemented, and how global health challenges are addressed through effective policy making. Are you ready to explore how economics connects to real-world health policies and reforms?